Okay. I think we can go ahead and get started. Like I said, really excited and appreciative that you've joined us for today's webinar, which is on managing compliance with the FDA's software bill of material SBOM requirements, featuring Cortez Frazier Jr., a principal product manager here at FOSSA, and Trevor Slattery, director of medical device security at Blue Goat Cyber. My name is Andy Drukarev. I'm also from FOSSA. I'll be your host for today's discussion. Before I go over our agenda and introduce some speakers, just have a few housekeeping points I'd like to cover. First, we will try to answer any of your questions as they are submitted. We'll also have time at the end for a Q&A if we can't get to them, but please post questions you have in chat or the questions section of your On24 console. Next, this webinar is being recorded and the on-demand link will be sent out to you after the event. And finally, we at FOSSA will be following up after the webinar with a few additional resources to see if there's anything we can do to help your organization with SBOM management and navigating the FDA requirements. And we'll also pass along contact information for today's speakers. So with that, let's take a quick look at our agenda. As you'll see, we'll start with some background on these SBOM requirements, kind of the origin story, if you will, before diving into some specifics. So what these SBOM requirements are, what they aren't, and then some of the challenges and strategies we've seen in our customers and organizations who are navigating these requirements and kind of best practices and recommendations as well. Now, before I hand things over to our speakers, just a quick word for folks who are not familiar with FOSSA. There are two main parts of our platform. One includes solutions for managing risks in your open source software. So this includes identifying and fixing vulnerabilities and prioritizing those fixes, as well as identifying and complying with open source licenses. The second part is an SBOM management offering, which supports generation, ingestion, distribution, monitoring, analysis, and that will obviously be largely the focus for today's presentation. With that, Trevor, did you want to say a few words about Blue Goat for folks who are not familiar with your organization?
Yeah, definitely. So Blue Goat Cyber does the full service for cybersecurity part of the FDA submission when you're clearing a medical device. We cover PMA, IVD, 510K for class 1, 2, and 3 devices. We'll prepare all of the documentation, perform all of the testing, and we also offer post-market monitoring as a service for any currently fielded devices.
Excellent. Now back to you both for some quick speaker intros. And Cortez, start with you.
Absolutely. Thank you. Really excited to be here. My name's Cortez. I'm one of the product leads. I'm over here at the FOSSA side. I lead our SBOM and vulnerability management products specifically. On the SBOM side, that includes everything from exporting SBOMs to importing them, so that way you can do continuous vulnerability monitoring, as well as sharing them for these application level SBOMs. So prior to that, I kind of served in a product role at Puppet, but more specifically as a cybersecurity architect at GE Power. And that was really where I got my first experience with vulnerability management in the SDA space. So we'll love to learn a little bit more about your background, Trevor.
Yeah, thank you. So I'm currently the director of medical device cybersecurity at Blue Goat Cyber. I handle a lot of the technical problems, making sure that our internal processes and client processes make sure they're aligned with the FDA requirements, and everything is in row there as far as the testing and documentation. I originally come from a penetration testing and application security background, and have started to make the trend more and more towards the regulatory affairs side of things.
Excellent. Appreciate those introductions. And I think with that, we'll kind of dive into the meat of our presentation with a look at the origin of the FDA's requirements. And some of this might be sort of review for some of the folks on the call if you've been living in this world, but kind of figure it would be good to level set. And Cortez, maybe you could take us through some of the highlights here.
Yeah, absolutely. This is definitely why we're here. I did want to note too, Trevor, you bring me back to some of my glory days. I cannot forget some of the fun that I had with the burpee suite, as I was just kind of tinkering around trying to break as much as possible in GE. So, oh man, I'm so jealous that you got to spend time as a penetration tester.
It was a lot of fun.
Without further ado, though, why are we all here? The origins of the FDA requirements, obviously the initial experience that all kind of brought us here that kicked off a lot of these SBOM requirements across many industries is Executive Order 14028. As we know, that is, for the most part, in direct response to what happened with SolarWinds. And we as a nation, as a Earth, as a globe, as just an entire people, quickly realizing that we don't have any insight whatsoever into the software supply chain of a lot of these critical programs that we're actually relying on, right? And so how do you know when something has a critical vulnerability? How do you be able to quickly assess that impact, not just on your first party usage, but then on that third party usage? And so that's what this executive order was kind of put in place to address, give us that bill of materials, allow for you to ingest that in a machine readable format, which will then directly solve, or at least begin to solve that problem. From there, the FDA then begins to draft some guidance around what should go into these SBOMs, what are some of these minimum elements extending upon the ones that NTIA put out. And we'll talk a little bit about some of those specific guidelines. And then as of March 29th, 2023, these are now requirements for any new submissions. So your 510Ks, your PMAs, and some of the other ones that are impacted here on the right. So I'm really excited. Trevor, maybe you want to tell us a little bit more about what some of these specific FDA SBOM requirements are.
Sure. So there are a couple of big things that we have to look at. The first, of course, is the SBOM. And you touched up on the NTIA requirements that the FDA then expanded a little bit upon, making sure that we're getting an accurate level of information as far as the components of the SBOM, the source of these components, everything going all the way down the line. Second big area that we look at is the end of support. So it's pretty common, especially in the open source world, to have a package that acts as a passion project or loses steam and then development ends, or continuous maintenance ends. When that's the case, it is not uncommon for a vulnerability to pop up and then never get remediated. So knowing when that end of life happens and knowing what the plan of action is to get around that is really important. And seeing these vulnerabilities pop up in unsupported products might mean that there's time to make a shift or find an alternative solution. The final really important thing to touch up on here for the SBOM is tracking the vulnerabilities. So even with components that are currently supported, vulnerabilities can pop up all the time. And they can come up in, vulnerabilities can be discovered that have been present for a very long time in a component, but they're only recently discovered by a security researcher. So that's where the continuous monitoring part of an SBOM comes in. You have to make sure that it's constantly tracked for these vulnerabilities as security researchers are discovering these findings, and it's not just a one and done process. So for having a complete SBOM, the key word there is complete. The SBOM can't miss any components, and that's oftentimes a struggle for a lot of organizations to get that full SBOM and know exactly what's in it. One issue that we commonly see is defining that scope and not going too far outside of it. So oftentimes certain other tools, or like an internal tool or a build script, will get pushed into a overall source code repository. And then when that happens, that can often be added to an SBOM when it is not actually part of a final product. Having said that, you need to make sure that anything in that final product is accounted for, along with everything that we had looked at as far as the end of life and vulnerability assessment. Once that's been covered and the SBOM is complete, you've tracked the vulnerabilities, make sure that you're remediating as much as you can. It goes on to sort of that ongoing phase. Continuous monitoring for the vulnerabilities, making sure you're not picking up anything that shouldn't be in there, and then having a good plan in place to share and distribute the SBOM. So the FDA mandates that current users of a product or a device have access on demand to a latest version of the SBOM. And that latest version is a very important part. You can't have an out-of-date one from the initial build, and that's why sort of that continuous building and continuous tracking of the SBOM is very important.
Thanks, Trevor. Quick thing before we move forward, had a question come in. Will the presentation deck and recording be shared with attendees? The answer is yes. You'll receive an email from us afterwards with a link to the slides as well as a link to the recording. So with that, Trevor, really appreciate that sort of overview. And And you mentioned this concept of a complete component inventory. And Cortez, wondering if you could sort of speak to some of the considerations around ensuring that that inventory is in fact complete.
Absolutely. And Trevor, I think you hit on what I think is a really, really interesting challenge, which is how do you ensure that your SBOM is representative of the final artifact, right? Oftentimes there's, build, test, and compile dependencies that are used in assistance of creating that final artifact, but are not actually in use. There's also maybe even smaller questions, which is just because a particular dependency or package is a part of a final artifact, is it actually being used by the software or the code within that particular component? And so we oftentimes are looking to represent only the list of components that are actually in use, that are deployed in the final artifact, and most importantly, providing unique identifiers to be able to associate those. I am a huge champion of package URL, in particular for open source components, because that allows for you to uniquely identify the components, which will then allow for whether internally in your own companies, with external companies in the form of Blue Goat, or even with the FDA themselves, can then ingest that to be able to look up your specific component to then associate vulnerabilities or end-of-life information. Of course, CPEs are really powerful as well in cases with such as commercial software where you're unable to provide a package URL. And the last one that I think is absolutely huge is this conversation around how do you represent a full dependency graph. Oftentimes, vulnerabilities will be in second, third, fourth, and fifth level transitive dependencies, and the only way to then be able to have a true assessment of how that vulnerability is becoming in is to be able to have the full dependency graph representation there. And the last thing I will say to this is oftentimes there's a misunderstanding that only direct dependencies are important as it pertains to creating your SBOM. Now, I am strongly of the belief that transitive dependencies are extremely important to include in consideration to have that complete picture. Trevor, I would love to hear from your perspective on how you think about the whole direct versus transitive dependency as a complete SBOM assessment.
Yeah, I definitely agree with you. It's really important to have that as a consideration. I think one thing that's really important, and you touched up on that, is seeing what is actually used in the final product. So oftentimes you'll see that there are multiple transitive dependencies that a certain aspect of are utilized in the project, but that might not necessarily be a vulnerable part of it. So tracking down what the vulnerability is, where that lies in the code, and how that's flowing into the product is very important. And it can often take a little bit of time to find that right balance, but that's so that you're making sure you're not doing too much work as far as having to essentially rebuild the library if there's a vulnerability that may not apply, and also avoiding the possibility of introducing unnecessary risk to the patient.
Absolutely. And I think that's also an interesting segue into what I continue to think about is static versus dynamic attributes of an SBOM, right? And so your supplier, your component name, the version, unique identifier, all very, very static attributes of an SBOM. But what about things like end of life or end of support information, which is going to change over the life of that particular SBOM? We'd love to hear more of your thoughts there, Trevor.
Definitely. So this is an area that can be a little bit difficult to track. Oftentimes developers for an open source project aren't releasing continuous information, and they aren't saying this is when we plan to have an end of life notification. They may just entirely drop off of the project. There are a couple of ways to get around this. The first is just having some continuous monitoring on a specific project, seeing, well, it hasn't been updated in 3 to 6 months. We're seeing a little bit of a gap there, and that could indicate that the project has essentially been abandoned. If that's the case, there should be an appropriate plan to make sure that any vulnerabilities that pop up are remediated, and a little bit of a risk analysis to see what the true impact of leaving that in the system would be.
I think what is then also really interesting is going back to that static versus dynamic structure. Obviously on the vulnerability side, as you mentioned earlier, Trevor, vulnerabilities are going to continue to come out on a regular basis, regardless of any updates that have been made to that particular code. And so there's both this interesting initial assessment that you have to do around your vulnerability posture when doing a pre-market or 510K submission. But then there's also then that continuous element of this. And I think it is super interesting to me because the question then becomes, how do you deliver these continuous updates to either, the FDA or hospitals or whoever is consuming, that particular end product, and be able to inform them of your exploitability status. Oftentimes we speak heavily here on the FOSSA side around, just because a vulnerability exists on a particular open source dependency does not mean that you're using that, as you were mentioning, in a vulnerable way, whether that be, particular component is not delivered, a particular function is not being used in a vulnerable way, you're not submitting the particular payload that is required for that to be compromised. And so having ways to be able to communicate that exploitability, whether that be, via things like the vulnerability disclosure report or the vulnerability exploitability exchange, become incredibly powerful. There's even things like obviously CSAF and other customer security advisories. And so I'm really curious as to how, you are thinking about that in your end, Trevor, the actual communication piece of these exploitability of vulnerabilities.
So that's a really interesting point to bring up, is what should be communicated as far as an SBOM. I know that we briefly had touched up on how important it is to have that distribution, have that sharing, and then there's a matter of what all is, included in that SBOM, what the actual impact of that is. Sure, we'll get into a little bit of the misconceptions here coming up, but oftentimes we'll hear a complaint of, well, if I share an SBOM, isn't that going to introduce just essentially a roadmap into attacking our system? And the answer that I usually try to give for that question is, well, no, that's not the case. We generate this SBOM, we have the vulnerability assessment, so we know what those problems are, and then we fix them before we're putting that out in the open. And there's not going to be an attack path as long as we have our proper cyber hygiene in place. Now, as far as getting the SBOM out into the open, sharing it for distribution, it's really important, and there's an industry-wide push, especially backed by the FDA, for cybersecurity transparency in all areas. And SBOM distribution is a very key part of this. Users of a medical device especially are entitled to know what they are using, what goes into it, in the same way you wouldn't want to drive a car if you don't know what parts are in the car. So having that information available about the makeup of a product is really important. As far as the actual method for distribution, we see a couple of different options. The first is manual requests. This is often a little bit more involved on the manufacturer's side to get that SBOM over. And what that process is, typically the user will fill out a form saying, hey, I'd like to request access to the SBOM. The manufacturer gets that form, reviews it, and then turns it over as quickly as possible, taking that latest version and passing it on to the customer. Having a portal is another great solution. There can be a private or a public portal, and that way it sort of takes out some of the guesswork. It can be included as part of the cybersecurity labeling for a device that you can access the SBOM at a certain location. It's always kept up to date and is out there for anyone to get. This is a great way to push towards that increased cybersecurity transparency, and it eases up on the workload of the manufacturer while making sure that users always have the latest version whenever they may need it. All of this sort of ties into that post-market phase, and once a device has been fielded, the continuous evaluation of a device. And so I'd be really interested in hearing your thoughts on what else might go into that area.
Yeah, I think that's like a really interesting perspective, right? Which is, if I want to be able to monitor this on a continuous basis, I need a couple of parts. One, I need a continuously updated vulnerability and end-of-life database. And those are often, the end of life in particular is often not sources that are easy to obtain. And so we'll talk about this, I think, in a bit more detail of like where you can think about associated end of life in particular for open source packages. But I think on the vulnerability side, it's a little bit much more straightforward. And so obviously you have some of your base sources from the MVD. They want to expand upon those depending on what types of components you're using, in particular for using, things like embedded systems and wanting to have specific, Linux kernel configurations in mind when associating your actual impact vulnerabilities. And so one is, does this vulnerability even exist on a particular package and dependency that I'm using? Step two then is obviously, am I exploited by this? And then step three is, how do I then communicate that back with my sharing or distribution method of choice? And so I think there is a lot of considerations that kind of go in place as you're addressing that kind of continuous monitoring piece of that.
Thanks, Cortez and Trevor, for, I think, that wonderful walkthrough of some of the key considerations. Before we transition into our next section, we do have another question. For SBOM distribution, who is actually legally entitled to it? Is it limited to customers or anyone?
So this is an interesting conversation that comes up pretty often. As far as the legal entitlement, it is current users of the device. Now, having said that, it is a strong recommendation in that push for industry transparency to provide that to prospective users as well. And it is not uncommon for prospective users to ask for an SBOM to know what they may be getting into when using the device. But to answer the question in short, only active current users are legally entitled to have that access.
Got it.
Trevor, nothing to add from my end. I think that's incredible.
Thanks, Trevor. We kind of laid the foundation in our earlier discussion around some of the considerations for these different areas of compliance with the SBOM requirements. Now, I think some of the pressing questions that might come to mind based on that conversation, and starting with SBOM scope. So we talked about this a little bit earlier about some of the pitfalls or some of the things that might make their way into an SBOM that perhaps shouldn't. But I think starting here, wondering, Trevor, if you could, speak to this first item of should we include everything in the SBOM? What is the appropriate scope?
Definitely. So oftentimes during a cybersecurity engagement, starting from the top and working our way down, a lot of components will get mixed into the source code that get generated in the SBOM during the first cut. This is just oftentimes part of the process, and often a lot of stuff that won't be in the final product gets included. So there are a couple of areas that we want to look at. If there are any build scripts, development tools that are purely for internal use that won't be included in the final product, those may require a little bit of an evaluation. Now, if those vulnerable components introduce a vulnerability into the final product as a result of the build process, that was something that we would need to account for and remediate. But more often than not, there may be a distant transit dependency with a vulnerability in a component that is purely used for a build script, and that isn't necessarily going to need to be included in here. Now, what's going into the SBOM itself as far as the components? This is an area of a little bit of contention. Sometimes you'll hear a discussion, what about SOUP? Now, SOUP, the software of unknown pedigree, is difficult to track. Oftentimes, that's any part of the tech stack that you can't include in the source code. So the source code specifically, any of the pulled in third-party components are what goes into the SBOM as a whole. Now, looking at the SOUP becomes a little bit of a different story. That requires a separate vulnerability assessment, and it's equally important, but it won't be tied into the same assessment as the SBOM. So in general, the SOUP is a little bit more difficult to pull together, especially since SBOM tracking tools such as FOSSA are a great way to clearly map out what's in the SBOM. But yeah, having that distinction, drawing the line, what's in the final device and what's not, is really important.
Hey, Trevor, I got two questions for you. I would love to get your thought process on as we think about what goes into an SBOM. One, how do you think about supporting software as it pertains to, I have a medical device and then I have maybe like a SaaS software that is in support of that particular medical device. Does that fall into the purview from an SBOM perspective?
So it depends on the scope of a submission or a test generally. When we're looking at a medical device that is submitted as a standalone system with an interoperable component, which may be the case with what you're describing, the scope of the SBOM would be for the medical device itself, and then that SaaS platform should have a separate SBOM. If they are viewed as an enclosed system in a single system, they would both be combined into a total SBOM.
Got it. And so that could actually then mean, in theory, in that kind of closed system regard, where you are building a closed system on top of commercial software, that you actually maybe have to obtain an SBOM from someone outside of your organization to then combine with your final SBOM. Is that fair to say, or a true statement?
Yes, and that's something that we see comes up from time to time. Oftentimes, there will be a component or an instance of a hosted platform that a manufacturer will build a medical device on top of. And they will often reach out to the provider for that platform to request any penetration testing results, any of their information and documentation, an MDS2 form, SBOM, anything of that nature as far as their disclosure and transparency.
No, that makes a ton of sense. And then my second question, and I want to admit that this is definitely a nuanced one, but I'm just really interested in your perspective, which is oftentimes in the medical device manufacturer world, what we see is obviously a lot of embedded systems, but oftentimes means that you are not having these, nice, wonderful package managers that can make it really easy to understand and identify components. And so if I am either, vendoring in a particular component myself, meaning copying and pasting it line for line off of the internet, at what I guess spectrum of copy and pasting, for lack of a better term, have I now created a new component for me in kind of that C and C++ land?
That's an interesting point that you bring up. So as you mentioned, it can be difficult to track down those dependencies for C, C++, these low-level embedded languages. When you're pulling that code straight off and just sticking it directly into a product, that would essentially be the same as, including in a requirements.txt for Python or whichever language you're going for.
Yep.
If you have a vulnerability in that component, which can often be a little bit more difficult to identify, but if we're assuming, you've done your proper analysis, you generate an SBOM as complete as and then you review it against what is included, and we're assuming that that is an accurate SBOM. We want to take a look at what the vulnerabilities are and the scope of changes. If you're taking maybe a couple small snippets of a functionality of a certain dependency and those are not known to be insecure, then that wouldn't necessarily be something that would pop up even if that finding or even if that component gets flagged as vulnerable. So it goes back to the original point of we want to see what the actual flow of the function is and where the source code is to know where that vulnerability is and if we're actually including it in the final product.
Absolutely. No, that's all super awesome. Thank you for answering my questions. I think that really helps give a lot of perspective. So.
Excellent. No, great conversation about SBOM scope. And I think wanted to now shift to how to handle end-of-life information for open source software, which can be tricky for some of the reasons that we discussed earlier. And this is an area where Cortez, Trevor, I'd love both of you to chime in. But Cortez, maybe start with you, just how you think of addressing this challenge.
Yeah, this is a really interesting one, right? Because I think on the commercial space is really straightforward. Someone will make an announcement, they will likely post that on their website somewhere, and then you now have like a really firm either end of maintenance, end of life, or end of support kind of status. Now the question is then how do you obtain that in a consistent way, right? Of course, there's the, let me just kind of grind through it, look up all of my commercial components, maintain an Excel sheet of that and be able to communicate that information. Obviously, that is very unsatisfactory for me as a product manager. I think then going to the open source side of it, that challenge then becomes exponential because that communication is oftentimes either doesn't exist in the first place. There are some data sources such as like endoflife.date and a few other ones that there's a few standards like Open EOX who are looking to address this challenge. But oftentimes developers either don't communicate it or it's hidden in change logs and Git repositories. And so it's interesting because I've chatted with the FDA about this challenge and it is a best assessment is my understanding at this time. And by best assessment, I think there's a couple of factors that you can look at. One of them is how often has the code base been contributed to? And so from our perspective, something that has not had any update from the maintainer over the course of the last 2 years is clearly abandoned. Now that 2 years mark may actually be too conservative for you, right? Maybe for you, it's a shorter timeline, which I know, Trevor, you can speak to here in a bit. And then I think the second piece that I just really want to point to is just because a particular piece of open source software has not been contributed to in a long time, doesn't actually mean that it is abandoned, right? Maybe it's just, for lack of a better term, feature complete. It doesn't necessarily need new functionality, but it is a massive signal that if a new vulnerability comes out, what is the likelihood that that will actually be addressed by those open source maintainers? And so would love to hear a little bit more about your thoughts on that side, Trevor.
Yeah, I feel like you touched up on a couple of really important points there. So my general rule of thumb that I like to stick with is 6 months is usually cause for concern. We don't see any activity going on in 6 months, it's worth at minimum exploring a little bit deeper. Now, there can be a couple of reasons. It could just be that maintainer doesn't want to support it anymore, got tired of it, and stopped supporting the product. You see vulnerabilities pop up, you don't see any new activity. It could also be the case you look into it and you see that there's just sporadic updates as vulnerabilities may come in. And kind of like you said, it would be feature complete. They don't plan on making any changes to the core functionality. They are more just playing catch up with any problems that pop up. And so that would often indicate that if those are being addressed as they're discovered every 3 to 6 months, whatever it may be, that may just indicate that that's the only development cycle. There isn't any continuous development ongoing, and that would be of less cause for concern. Now, once we get into the 1 year, 2 year range, like you said, that's usually a pretty clear indication that development is done. It's not common that components will be left out for longer than a year or two without any new vulnerabilities being discovered, especially well-used components. I know a colleague of mine has talked to me a lot about the process to develop truly bug-free code, and he did it as part of his master's program, and I want to say it was something like 40 pages of proof for 2 lines of code to prove it was completely bug-free. So it's pretty slim on the odds that you would see a year or two with no development and no vulnerabilities pop up.
That's insane.
Again, it can be a case-by-case basis. And so if you see sort of that scattered development, it's just something worth looking into a little bit more.
And how do you think about communicating support information, right? So my understanding is that there is no SBOM format, specifically CycloneDX and SPDX, that has native support for communicating end of life. This is something that we handle at FOSSA with a property, a custom property on the CycloneDX side. I know that also today there is actually not an FDA requirement to specifically embed end of life support information in the SBOM, as much as that is a convenient way to communicate that, as I believe it is a separate form on the submission side of the house. And so I'm kind of curious as to how do you think about communicating that information? Is that a Excel sheet in your mind? Like how are people doing that for your world?
Oftentimes it would just be a very large Excel sheet, which, is not an ideal solution. So as part of our approach when we're going through a full submission, we look at sort of the plan to remediate these as they come up. So we'll document what the current support is for a product and see if it's expected to continue receiving support, all of that as we're going through an initial assessment. Next part is we prepare specific documentation saying this is how we're tracking end of life. This is what we're going to do if we see something reaches end of life. This is our assessment procedure. All of that is covered as sort of a blanket coverage statement so that it's an ongoing continuous process instead of just one and done. We say, this is the anticipated end of support for all of these, whether or not they're currently active, ship it out the door. So it's a continuous process, making sure that we're tracking everything as it's ongoing.
And then maybe just my last question on this piece of it is, what are those kind of steps or guidance, whatever you're comfortable sharing, that a customer can do when they do experience end of life or end of support, packages, right? Obviously, there's the rip and replace is the easy one, but I'm sorry, the easy one to think of, the much more difficult one to implement for a product that's already out there in the wild. And so, what are some of your opinions there?
Definitely. So as purely cybersecurity, tester side, application security, I don't come from a developing background. And so when I say, oh, it's an easy solution, just replace this with that, I always hear developers immediately tell me, no, it's never like that. So I understand all the problems that may come up as part of that process. If it's possible to replace it with a different component, fantastic. It's often easier said than done, but sometimes it is just that easy. You're able to replace it with an equivalent component, make some minor changes here and there, and then see what you can do from there. Now, the alternative, and this is often the what needs to happen if there is no viable solution, is either essentially creating your own spinoff or a fork of that component. So the fork of that component can address the specific problems, and creating a spinoff, doing it from scratch and maintaining it yourself is an alternative solution. It's often going to be a lot more labor intensive when just creating a fork. It's one of the beautiful things about the open source community. All of these are pushed out. You can create your own changes and then include that as needed.
Really love that. I'll even throw a third one out there as a open source champion, which is at the end of the day, if you are a company that is actually in a position where you're heavily relying on an open source package that is no longer maintained, maybe even consider reaching out to the maintainer itself and seeing if there's a commercial agreement that you can establish there to incentivize some of that additional support status. If it works for Microsoft, I think the open source maintainers can pull it up too. All right, Andy, back to you, my friend. Mm-hmm.
Excellent. Yeah, no, I think great conversation there. And this, moves us to an existential question: to share or not to share when you're talking about SBOMs. Obviously, when you're submitting a pre-market submission, the SBOM is part of that, but there is this bigger conversation about, how transparent and how public you should be with your SBOMs kind of to the world. And there are strong opinions on both sides of this. But Trevor, maybe can start with you. What you hear from your customers at Blue Goat? What are some of the concerns, and what is your perspective on this? And then, what maybe we could then hand off to Cortez to talk about some of the portal-specific sharing options that exist today.
Definitely. So when we're going through the list of requirements that we need to develop as far as a process for the FDA, this is probably the single area that creates the most frustration for a lot of manufacturers. When we go in and we say, this is what the process needs to be, the FDA requires that this SBOM is available. Oftentimes we'll get a little bit of pushback on the validity of that and the security of that. Now, there are two big concerns that we see. The first is that this is giving away proprietary information about the buildup of a product. Typically, that's not going to be the case. Most products require a lot more than just the sum of their parts. So you're not going to be able to recreate a device just by seeing the third-party components that are included in 99% of cases. So this is rarely something that we see as a viable possibility. Of course, if it's still a concern, we look for a couple of solutions as far as restricting that access down to the required people who are legally entitled to get that SBOM. And that kind of goes back to the point to current customers versus prospective customers, and who can have access to that. The second thing that we see is, well, this is essentially just giving people a roadmap to hack into our system. And in the same way, that's also not going to be the case. What we want to see for an SBOM is transparency and disclosure and security. It can be dishonest to hide vulnerabilities and say, well, if we turn out that SBOM, it's going to show what vulnerabilities we have. It is the medical device manufacturer's responsibility to remediate these vulnerabilities in a timely manner and make sure that a device is secure as it's fielded. Having an SBOM pushed out into the open that users can see, prospective users can see, and they're able to see that continuous development, that continuous practice and effort towards security gives them the reassurance that they are using a safe device, and lets manufacturers have that added bonus of presenting that to users, that they have a safe device and they're giving that out.
Yeah, Trevor, I'm really curious, kind of given your background as a penetration tester, because there's this misconception that I often hear with even some of our customers, which is, to your point, suppliers don't want to share their SBOMs because they fear that they're giving away some type of secret or insight for a threat actor to be able to attack them. And so when doing penetration testing, how often are you looking for hyper-specific attack paths as compared to a much broader, brute force approach to what are all the possible attack paths and then finding your way in through there? Does that make sense?
Yeah, totally. So I can give a little bit of perspective as a penetration tester and then explain the typical approach that we see from threat intelligence as a threat actor. Now, I'll start with the threat actor perspective. This is often a little bit of a misconception. Very rarely are there actually targeted attacks from a threat actor. They go broad and wide, and they try to look for problems. They'll look for a misconfigured VPN appliance. They look for super common CVEs, such as like Jenkins servers left out on the open with remote command execution vulnerability. That's what a threat actor is looking for. They aren't picking, in most cases, a specific organization and trying to dive in as deep as they possibly can to see what they can do. Now, as a penetration tester, that's what we have to do. We have the specific organization and we have to do anything we can to get in. While it's not super unheard of, it's pretty rare on a penetration test that I would see a third-party component and a source code library, or even an exposed component such as an out-of-date OpenSSH server, and be able to get straight through into a network. It happens from time to time, but typically what I'm looking for is password 123 on a login page. And that's what I would find with success 99% of the time. Stuff like that, or a fully up-to-date printer with no known vulnerabilities and they just never change the password. That's usually what is going to be the path of least resistance. So it's really rare to find an avenue in from out-of-date third-party components.
The good old admin password. If you don't take anything away from today's webinar, please change your local Wi-Fi admin password because it's probably still using the default. Yeah. Sorry, one more other thought on this one, Trevor, before I kind of go into maybe some particular sharing techniques is on the IP side. And obviously I want to preface this with, neither one of us are IP lawyers. This is not legal advice, but, from my perspective, the usage of a particular open source package is not IP in of itself, in particular if it's open source, right? The commercial side, maybe that's a different conversation. In the same way that your usage of your hyper recursive if statement is not IP, right? Oftentimes it is your data that is IP. It is the combination of how you're interfacing with different APIs and web services that is IP. Is that kind of a fair assessment as you look across your customer base as well?
Yeah, and I think that part of what people are concerned about is not necessarily giving away their own IP, but giving away what they did as far as their process. So, and again, like you said, I'm not an IP lawyer. I don't know what the specifics are from a legal perspective, but just from a development and practical perspective, oftentimes manufacturers are saying, well, these are the steps, these are the components that we pulled in to create this product. So they might see, oh, we're using this for our PDF generation library, for an example. They can try to replicate that process. And, like I said earlier, there's so much more that goes into it than that. And you would be definitely pretty lucky to be able to replicate a product by looking at their SBOM.
Absolutely. No, I agree 100% spot on. And so the only thing I will kind of, wrap out on conclusion on the SBOM sharing side is one, obviously, I think we're huge components of sharing SBOMs. I think it's healthy for the industry. I think I imagine a world in which any hospital can go into a repository, grab SBOMs for potential products that they want to consume and be able to make assessments on the security, and the risk of those. Now, the way you go about sharing it, I continue to want to harp on this difference between static components of your SBOM and dynamic components of your SBOM. And so you'll want to share your SBOM. That could be via a portal. FOSSA has one that will allow for you to do so publicly if so desired, but more specifically privately with time-based access tokens. So that way, if you only have a customer who has your product, say for the next few years, you can assign that to them over the course of that time and then revoke that access on the back half of that when they're no longer kind of consuming that. And then, that is obviously a very static version of that. I think the dynamic piece of that is then as new vulnerabilities come out, being able to continuously republish. So that way you now have up-to-date VEC statements to kind of communicate exploitability, become two very, very powerful components of sharing SBOMs.
Excellent. So kind of the fourth big question that we have on our list is now what? So you've completed your pre-market submission, and where do you go from there? And Trevor, wondering, I know this is something that you work closely with a number of your clients on at Blue Goat, and wondering if you could kind of share some of your thoughts on this question.
Definitely. So part of what we do at Blue Goat is post-market monitoring for a fielded device, which the FDA is a little less clear on their guidance as opposed to the pre-market process due to the fact that it has to account for all of these legacy devices. Now, having said that, the SBOM guidance is definitely pretty clear. Once a product has been fielded, SBOM should be kept fully up to date. So as development is ongoing, as new components are added, versions are changed, old components are removed, the SBOM needs to reflect that. That's a very important thing to make sure that is fully up to date. The second area, and I know we've touched on this, is the continuous access. Users need to have that fully up-to-date SBOM. Legally, only the current users are entitled to it, though we recommend that prospective users are able to have that access as well. And ideally, it is just public information out there. And that's really driving that transparency across the industry. The next thing that we're looking for is vulnerability tracking for vulnerabilities in general, and specifically vulnerabilities in the CISA known exploited vulnerabilities catalog, which the FDA states that any of these should be designed out of the system, meaning it's essentially a big problem to have any of these findings in the system and they're able to actually impact the system. Now, having said that, those aren't the only findings that are applicable. It's a pretty large list, but there are many different vulnerabilities that can pass through an SBOM into a final product. So that continuous monitoring of an SBOM is really important to identify these vulnerabilities as they pop up. Now, once a vulnerability is identified, the next step is the response. This usually comes in two parts. So the first part is that remediation, whether that's updating the component to the latest version, replacing it with a different component or a homegrown solution, whatever it may be. And the second part is the validation. So part of a proper test is the remediation validation testing, ensuring that any fixes are populated into the device. And part of that can just be reanalysis of the SBOM, a manual inspection of the code to see what the process flow is through the code base, and ensuring that anything that may have been a vulnerability is no longer actually present in the final system. In general, we just have to make sure that SBOMs are fully up to date and secure, and that users can have that immediate access, or well, not necessarily immediate, but fully up to date access and in a timely fashion.
Excellent. So with that, we're kind of through the bulk of our webinar. So if you do have any questions, please go ahead and share them now. But we do have a few final kind of wrap-up slides here. Next steps. So first and foremost, thank you once again, everybody, for attending today's webinar. We hope you found it useful. If there are any further questions you have, or if you are looking for some more support in this area, we definitely would encourage you to contact Blue Goat for comprehensive services, and FOSSA for SBOM management, including kind of some of the SBOM sharing portal capabilities that Cortez discussed, and contact information will, as I mentioned at the beginning of the webinar, be made available in our follow-up emails to you. Additionally, we have several kind of resources that will be included in those emails. So links to articles that we've published on this topic. So keep an eye out for those. Yeah, that sort of wraps it up. So I'll give it another minute for any questions to come in. But if not, Cortez, Trevor, thank you so much for taking the time to do this. I think this is a wonderfully insightful conversation about, obviously, still very evolving and still early days set of requirements, and hopefully kind of demystified this a little bit for everybody on the webinar.
Yeah, it was great to...
Sorry, go ahead, Trevor. My apologies.
No worries. Yeah, it was great to have the opportunity to talk about this with you guys, and I think we definitely touched up on a lot of really important points here.
No, I completely echo the sentiments. I think it's been a great conversation. I'm going to throw a curveball out of nowhere at you, Trevor, which is a question that is selfishly on my mind, which is what is your pontification on at what point in time all hospitals will start demanding SBOM from medical device manufacturers?
Oh, all right. Well, I want to come across with two perspectives. So the first perspective being my continued shift towards regulatory affairs, where I see the vision and I see the hope. And I'm hoping that within the next 10 to 15 years, we're seeing that cybersecurity transparency really kick in and really become a little bit more of commonplace in the industry. Now, coming in from my penetration testing background, where I still very commonly see Windows XP in these hospital networks, I see that might be a little bit of an unrealistic approach.
Yeah, I think that last sentiment there is 100% spot on, my friend. So, no, I mean, it's been a great webinar. I really appreciate your insights, your industry perspective, and I definitely learned a lot today.
Yeah, likewise.
Awesome. Cool. So then with that, we will go ahead and wrap today's webinar. Like I've mentioned, keep an eye out for some communications from us with contact information and additional resources. But I think that will close our conversation. So once again, Trevor, Cortez, thank you so much for being here and for all of your insights. And to everyone who attended, thank you as well. Hope you found this useful. With that, have a great rest of your Wednesday. Take care, everyone.
Take care, everyone.
Have a good one.